This video is about dysphagia, the signs you need to look out for, and what to do if you are concerned about somebody's ability to swallow food and drink safely. Dysphagia is difficulty swallowing. It might be hard to swallow food, drinks, or both. You might see the following signs if someone has dysphagia. Choking. This is where food gets stuck in the airway and stops a person from breathing. Coughing when eating or drinking. This can be mild or severe. In severe coughing, a person's face might change colour and/or their eyes might water. Trouble breathing whilst eating and drinking. Struggling to chew food. A person may not be able to move the food around their mouth enough to break down large lumps in order to swallow. Having lots of chest infections. These can be caused by food going down the wrong way and getting into the lungs. A person's voice might sound different during or after meals. It might sound wet or gargly because there is still food or fluid left behind after swallowing. Being upset or in pain during mealtimes. Food and drink may come back up through the mouth or nose after swallowing. If you see any of these signs, you should refer to the Community Dysphagia team. We're part of the Community Learning Disability team. You can phone us on 0114 226 1562 or email cldtbusinesssupport@nhs.uk. If you're not sure if a referral is needed, it's okay to contact us for advice. When you make a referral, a member of the dysphagia team will phone. They will ask some questions to find out how best to help. They might give you some suggestions of how to swallow safely. If necessary, someone from the dysphagia team will arrange to visit you to complete an assessment. We may need to see you at a few different places, like home and day service. During your assessment, we will watch you have something to eat and drink. We will ask you questions about your eating and drinking. And we'll also talk to people who support you about your eating and drinking. We might look in your mouth or touch your neck, but we will always ask before we do this. We will then write a management plan for your eating and drinking. It will have instructions on how to make eating and drinking safer for you. This might mean stopping eating certain foods that are difficult for you to chew. It might also mean changing the way your food looks and feels, or making your drinks thicker. We might give instructions about your seating and position. If someone else helps you to eat and drink, we might give advice where they should stand or sit when supporting you. The management plan will depend on the difficulties you're having. Your dysphagia clinician will work with you and people who support you to make sure you are eating and drinking things that you enjoy but are safe for you to have. The dysphagia team also help people who have certain behaviours when eating and drinking that put them at risk. Things like eating too fast or putting too much food in their mouth. We can give advice to help reduce the risk these behaviours may cause. Remember, if you're worried about yours or someone else's eating and drinking, or you observe any of the danger indicators mentioned before, get in touch with the Community Dysphagia team. Don't change someone's food or drink without getting advice first. If the person has an eating and drinking management plan and you think it needs changing, call us and ask for advice. Not addressing eating and drinking risk can lead to serious illness and sometimes having to be treated in hospital. Thank you for listening.